It was about 6 weeks ago that I let you know that unfortunately it appeared that Omicron, which was just discovered in South Africa at that time, was going to spread across Europe and unfortunately spread across the United States. Unfortunately, I was right in that projection, but hopefully the advance notice that you had was somewhat helpful as you prepared clinically for the onslaught of COVID that we would experience. The good news that I can give you today is that it now looks like the data is much better. I'm as optimistic as I've been in a long time that we're going to enter into a period of time, maybe a long period of time, where on the clinical side, COVID's going to be significantly better. Why do I think that? I think that for several reasons. First, if you look at the countries and the states that first were hit with Omicron, there's been a dramatic decline in the number of cases in those areas. Omicron started in South Africa, where they were reaching a peak of 40,000 cases of COVID a day. Case counts are now down over 90% in South Africa. And even in the United States, the states that got hit early on, like New York, New Jersey, Massachusetts, and even Florida, are now seeing dramatic declines in the number of cases. The second reason that I'm optimistic is that we now definitely know that the most recent variants are far less fatal than the COVID that we have been fighting for the last couple of years. In fact, there have been some very in-depth analysis done by public health folks who have concluded that a vaccinated person that gets COVID is at less risk of going to the hospital or of dying than someone that gets the flu. In essence, we're just fighting something that's very different than what we've been fighting in the past. Now, the optimistic view would be that maybe this is the beginning of the end. When you look at the history of other pandemics, this is what happened. Variants continue to develop that were more contagious but less fatal until eventually we just learned how to live with the virus that was out there. The optimist in me hopes that that's what we're experiencing now. It's possible that I'm wrong and that there will be a variant that will get around the vaccines and that will be more harmful, but it's actually more probable than not that we're entering into the phase of a virus that we're able to cope with and that clinically we can recover. And then most important, that we recover on the business side, that we get our workers back, that we get our census back, and that we can move forward. Whether I'm right or wrong, or whether the pessimistic or optimistic scenario develops, you can certainly count on the fact that we will be here with you and with our state execs fighting this virus until we get through this horrible tragedy that you've experienced.